Can everybody hear me?
Yes. Can we all pause for just 1 second?
I just can't hear people. I don't know why.
Nikki, pause for just 1 second, please, before we start the meeting. Let's make sure Dylan's on. Hold on 1 second, please.
Wendy, do you want to go ahead and get started? Or are we waiting for Richard? Even though I can't hear. If you guys can hear me, then I could just kind of go through.
Dylan's on. Nikki, we're good to go.
I can't hear.
Okay. Good morning, everyone, and welcome to our May Continuum of Care Committee meeting. We're happy to have everyone present. We need to just do a couple of housekeeping things here. If you are not speaking, we ask that you mute your microphone and if you're using your phone, don't put the call on hold because background music will really goof things up. So that's our big request. We're going to do a roll call here, and then we will your answer yay or nay to your name, and we'll get started.
Okay, I will begin roll call. You all can hear me now.
Yes.
Don Bogart. Melody Boyette. Vanessa Cartel.
Present.
Sylvia Chavez. Allison Cook Davis.
Present.
Erin Cohen Hay.
Present.
Jessica Cruz. Kathy Dinolfi.
Present.
Bernie Peralta for DC Ernest. Nicole Gibson.
Present.
Anne Marie Johnston.
Present.
Christina Lopez.
Present.
Marcy McFarland.
Present.
Jim McPherson. Jennifer Page.
Good morning, Jennifer Page from Mercy Cares here.
Good morning. Gerardo Pena.
Present.
Aaron Rain. Tyler Rosensteel.
Good morning, present.
Shayla Schuster. Sarah Sims.
Good morning, present.
Laura Scott-Nicky. Michelle Stokes.
Yeah.
Craig Tripkin. Jocelyn Wilkinson.
Present.
And we have co-chair Richard Cruz.
Present.
And co-chair Wendy Johnson.
Also present. We don't have closed captioning.
Okay.
That
Jeremy,
needs to be turned on.
Jeremy, is that something you can fix?
Yeah, it should be on now. I just enabled it.
Thank you, Jeremy.
Yeah.
Did I miss anyone?
Sylvia Chavez, Arizona Department of Education. I was late.
Good morning. Good morning, Sylvia. Thank you. Back to co-chair Johnson. Thank you.
Thank you. The next item on the agenda is a call to the audience. Members of the public were given an opportunity to submit written comments relating to this meeting via azmag.gov comment within 1 hour of the posted start time for the meeting, or can join by Zoom by requesting a link from the MAG staff or registering on the COC committee meeting event page. If you are wishing to make a comment, please raise your hand in Zoom and you will be invited to unmute at that time. Public comments are limited to 3 minutes. MAG staff, were there any comments received or anyone who has joined the call to offer comments?
Yes, we received one comment. It's,
Oh.
sorry.
No, that's okay. Do you want to share that comment, or would you like me to do that?
It's up to you, Wendy.
Oh, heck, I'll do it because Richard gets to do all the fun stuff normally.
Okay.
Stephanie Smith has submitted a comment regarding agenda item 5. And when we get there, we'll remind ourselves of this. She says our data has shown that creating a COVID prioritization was effective in properly serving the targeted population. She respectfully suggests that the committee and the coordinated entry subcommittee to consider continuing prioritizations in the future. A timely prioritization would be for unsheltered adults most vulnerable to heat-related illness. There are a number of heat relief efforts ongoing throughout the valley, and coordinated entry prioritization would help support those efforts. We thank Stephanie for submitting this thoughtful and proactive item. We will now move on to the next agenda item. Hey, more from me. Our next item is the approval of the April 6, 22 meeting minutes. Does any member of the committee have questions or comments on the minutes? I'm looking for hands. I don't see any hands. So I'm requesting for a motion to approve the April 6, 22 Maricopa Regional Continuum of Care Committee meeting minutes.
So moved.
Richard Cruz moved. We have a motion from Richard Cruz. Do we have a second?
I'll second.
Was that Laura?
Jocelyn.
Okay. Did you get that, Nikki?
Yes, Richard
All right.
first,
Awesome.
Jocelyn second.
Is there any discussion needed for this topic? I will ask Nikki to proceed with the roll call. Please indicate clearly how you vote, stating yay or nay after your name is called.
Okay, Dawn Bogart. Melody Boyette. Vanessa Cartel.
Yay.
Sylvia Chavez.
Yay.
Allison Cook Davis.
Yay.
Aaron Cohen Hegg.
Yay.
Jessica Cruz. Kathy Dinolfi.
Yay.
Bernie Peralta for DC Ernest. Nicole Gibson.
Yay.
Anne Marie Johnston.
Yay.
Christina Lopez. Marcy McFarland.
Yay.
Yay.
Jim McPherson. Jennifer Page.
Yay.
Gerardo Peña.
Yay.
Aaron Rain. Tyler Rosensteel.
Okay.
Chayla Schuster. Sarah Sims.
Yay.
Laura Scott-Nicky. Michelle Stokes.
Yeah.
Craig Tripkin. Jocelyn Wilkinson.
Yay.
Co-chair Richard Cruz.
Yay.
Co-chair Wendy Johnson.
Yay.
Did I miss anyone? The motion passes. Thank you.
Awesome. Okay, now it's my turn. So the written updates were included in the packet, including a legislative update. There are a number of trainings happening over the coming weeks, including an employment training on May 17th and a diversion training on May 20th, right? So mark your calendars so we can see you all there. If interested in attending, please reach out to Katie at kgentry@azmag.gov. Does anyone have any questions about the update memo or have discussions on the legislative update? Okay, hearing none, this is the part, since you didn't talk there, I expect you to talk in this next part because it involves like what you're gonna do. Before we move to the next agenda item, we wanted to get input on returning to in-person meetings because as much as I love your squares, I love your faces in person even more, but I promise I won't squeeze your cheeks because I don't do that. That'd be weird, right? But to in-person meetings, we're staying virtual. Committee members will have the option to always join in hybrid format. So like if you want to stay at home or from wherever your office is and do that like, you know, non-AT&T thing and not reach out and touch someone, you can totally do that. That's okay. However, the switch to in-person meetings would allow members of the public, right, like who we actually serve, to attend meetings at the MAG office or stream via YouTube if we choose to stay virtual. Members of the public can join the meeting to offer comments as they do now or stream via YouTube. Do any committee members have thoughts they would like to share on like whether or not we go like in person? Yes, I'm all for it. Okay, that's what I like to hear. Okay.
Same.
Laura, I saw you raise your hand. You're muted. Well, you're not muted, but I can't hear you. So, Laura, I want you to work on the sound piece because for whatever reason, you're not showing as muted, but we still can't hear you. So I'm going to go, I'll come back to you in just a moment, okay? Vanessa, what are your thoughts?
Just want to say I think that's a great idea, and especially keeping it hybrid for those who may not feel comfortable yet, but an option for us to get in person and have that conversation. I think that's great.
Awesome, awesome, awesome. Laura typed in, I'm great with that. Can I just get like a show of hands so that we know, right? If we meet in person, will you be there, right? Like, you know, so like put your hands where my eyes can see. Okay. Good deal, good deal. I just don't want to be in a room all by myself, right? Where it's just me and Wendy talking to each other and we got a bunch of like screens set up and it's weird, right? Okay. Beautiful, beautiful. We got hands. This is good, this is good. Do we have any questions or other comments, anything?
Richard, this is Wendy Johnson.
Yes.
The thing I want to tell you guys about the showing up part, it's important for us as a committee. It's good to be in a more fluid space, but we're asking the MAG staff to go to a lot of work for us to do this. And we don't want to have the meeting with just Richard and I sitting alone in a big room with chairs. So, you know, let's do our part to follow through with what we can do together and not disappoint poor Katie, who's not here, for putting all those chairs around the table and all the hand sanitizer and everything that she does to make us happy. So thank you.
Awesome. So yay. So I'm excited. I'll be excited to see you all next month. Michelle says for in-person meetings, would cart services be provided? Michelle, yes, they will do everything they need to make sure that it's fully accessible. So just so you know that. So that's good. Yes. Yeah, we wanted to make sure we didn't lose that. So definitely that'll be a thing that, all of the pieces that are necessary to make sure that everyone has the ability to have access to the meeting. We want to be able to do that. This is also like an opportunity when it comes to people that you think should be on the COC in the future, right? Since we don't add people to the end of the year, which I'd love to change, but that's a whole nother conversation. But since we don't add people to the end of the year, like people need to be able to touch it and interact with it and engage with it in a different way than how we currently do it. So this way, one, when you get here, it's not your first meeting, it's not your first rodeo with us, but also then it allows for us to hear, like we can hear from the people who could potentially come in at later dates. And then Laura, I'll say your comment, and then remember all, well, Laura, you're good because we can't hear you. So I'm not going to say that, like, don't type in the chat. But Laura says, I appreciate that virtual will still be an option as I'm currently participating while working out of town. Beautiful. Yes. Yeah. We don't want to exclude anybody, but for those that are comfortable being in person or have the ability to, because some of people are comfortable, they just don't have the ability to be there. We want to be able to have that medium for you. So we'll move on to the next agenda item unless there's other conversation that people want to have. Hold on, my screen just decided to mess itself up. Hold on just a second. I'll get back to where we were in the agenda. We did that. Okay, so next we'll be talking about the coordinated entry pandemic prioritization. We have Jasan Goodman with the Phoenix Rescue Mission and co-chair of the coordinated entry subcommittee, who will provide an overview of the change to the coordinated entry pandemic prioritization. Jasan, are you ready to go?
Yes, I am. Thank you so much. Can everyone hear me?
I can.
Perfect. Once again, my name is Jasani Goodman, and I am with the Coordinated Entry Subcommittee. And thank you so much for allowing me to come and just share a very quick update as a Coordinated Entry Subcommittee, knowing that the emergency declaration ended at the end of March. We wanted to basically receive feedback from this subcommittee before moving it for approval to the board to sunset the pandemic prioritization, as well as the COVID risk screening questions in HMIS that directly feed into the prioritization for coordinated entry. I do want to point out that what won't change is the questions as it relates to testing and sickness status, as well as vaccination tracking. Those questions were implemented separately from the pandemic prioritization, so that won't be affected. We're strictly just looking at the prioritization as well as the questions that pertain to that. So we really just wanted to receive your feedback. We wanted to hear your thoughts before bringing this up to the board. I know Stephanie Smith submitted a comment, and so we just really wanted to open it up to just hear everyone's thoughts before we proceed and address the board with this request.
Awesome. So I want to say thank you. Okay, we'll jump straight into the questions. Wendy and then Vanessa.
And thank you for bringing this up, and it's wonderful. Are we looking at pandemic? The word pandemic is in there, and really what we're looking, I think, is just prioritization based on criteria, correct? So if someone is medically compromised and could suffer from being on the street, they would go up a notch. If they are getting dialysis and could dehydrate on the street, they would move up into that prioritization for shelter beds, correct?
Yes, that is correct. This is specific to the pandemic. So this is specifically screening for individuals that are a high risk for COVID, I guess you could say, where it's a great health impact, right? And that they're extremely susceptible and vulnerable. And so it is specific to COVID-19. But yes, other health factors outside of that, other parts that make them a vulnerable individual, those are still parts that would be considered as a result of in the prioritization process, I should say.
Thank you. Vanessa.
Hello, Vanessa Carthel from ABC. Hi. My question is, would there be protocol or policy in place to if there was another wave where COVID cases increased, would there be a policy in place to temporarily reinstall the priorities? And what would that look like?
Yeah, we can definitely discuss that with the coordinated entry subcommittee leads, just to have an idea of what that looks like, to be able to, I guess you could say, temporarily implement in the case of another wave. That's definitely something that we could talk about. I don't have an answer as far as, a specific procedure for that, but I don't believe that that is completely off the table. If another wave were to come through and as a result, we're starting to see an increase in numbers and individuals living on the street who are at high risk are needing to be prioritized, we can definitely look to see if there's a way that we can implement some sort of temporary reintroduction. We can discuss that amongst the committee and hear that feedback as well.
That would be great. Yeah, that's my feedback, is just that our system remains flexible and learns from, our experience in this pandemic and this emergency kind of like disaster response, and having policy, maybe not just to COVID, but other possible, just an overall procedure and policy of how coordinated entry responds to disaster emergencies, things like that. Thank you.
No. Yeah, thank you so much. I love what you said, that our system would remain flexible. And so, yeah, most definitely, I appreciate that.
Thank you, Vanessa. Other questions, comments, discussion? Okay. And Laura says she agrees with Vanessa's comments and concerns. Thank you so much, Laura. Thank you for that. So with that, can I have a motion to approve the removal of the coordinated entry pandemic prioritization?
This is Kathy. I'll make that motion.
Okay, it has been properly moved. Is there a second?
This is Ty Rosensteel with Solari. I second.
It has been properly moved by Kathy Dinolfi and seconded by Ty Rosensteel to remove the coordinated entry pandemic prioritization. Is there any discussion on the motion? Hearing none. Now I will have Nikki to proceed with the roll call vote. Please indicate clearly how you vote, stating yay or nay after your name is called.
Dawn Bogart. Melody Boyette. Vanessa Cartel.
Yay.
Sylvia Chavez.
Yay.
Allison Cook Davis.
Yay.
Aaron Cohen Hegg.
Yay.
Jessica Cruz. Kathy Dinolfi.
Yay.
Bernie Peralta for DC Ernst, sorry. Nicole Gibson.
Yay.
Anne Marie Johnston.
Yay.
Christina Lopez.
Yay.
Marcy McFarland.
Yay.
Jim McPherson. Jennifer Page.
Yay.
Gerardo Pena.
Yay.
Aaron Rain. Tyler Rosensteel.
Yay.
Chayla Schuster. Sarah Sims.
Yay.
Laura Skotnicki.
Hopefully this works. Yeah, yay.
Yeah, we can hear you. Michelle Stokes.
Thanks.
Craig Tribkin. Jocelyn Wilkinson.
Yay.
Co-chair Richard Cruz.
Yay.
Co-chair Wendy Johnson.
Yay.
Did I miss anyone? The motion passes. Back to you, Richard.
Awesome. Awesome. Okay, now moving on to the next agenda item. The system flow dashboard. Stephanie Crum, HMIS manager at Solari, will provide a recap of the system flow dashboard and updates since March. Stephanie,
Hello.
are you ready to go?
I am ready to go. All right. Thank you, folks, for having me. And let me see. Let me share my screen. Can everybody see? Okay. All right. Great deal. All right. Let's dive right in because we've got a little bit to cover here. So let's go ahead and start with our active overflow and our total number here. As you can see, we are starting to see a significant spike from February to March for all households. It is being driven, of course, here by singles, but I do want to point out that there is a spike in families as well. It's just not as prominent just because of how this is pulled out, but there is a spike across all the board. It is being driven a little bit here by singles. As we scroll down, we're going to look at our subpopulations here. And again, you can see the spike is really across the board, but the most significant ones I really want to call out here are our BIPOC subpopulation and our unsheltered. These are significant spikes of almost 12% in just 1 month. Can't help but think that there's probably a correlation here between the unsheltered and the BIPOC as well, as those are pretty much matching in their spikes here. But as we see, everything is up, chronic, all populations, youth, veterans. We are still aligning our data with the VA BNL, but we are still seeing a little bit of a spike there and also in youth. So pretty much across the board, everything is jumping up here a bit. If we get into details, let my page load here, sorry. Here we go. If we get into details, we'll see again what we saw on the other page, which is a spike from February here. We're definitely seeing our inflow outpace our outflow. When you get down here to inflow detail, it's hard to really distinguish if it's returns from inactive or new households. New households is a bit more of an increase. I believe it's about 26%, where return for inactive looks to be about 24% increase. So they're pretty close, but it is being driven just slightly more by new folks entering our system. One data point to keep an eye on here is our unknown negative exits. We do see a drop here from February, but this will be something to keep an eye on. Is this a true drop, or is this folks staying in the system a little bit longer as the weather is starting to heat up? We are seeing a little bit of an increase here in positive housed exits, and that's always a good thing there. The one thing I do want to point out and just make everyone aware of is we're heading into our summer spike. You know, this does happen every year. This is just something that is a system pattern for us in the extreme weather that we do experience in the summer. However, if you look back at where our spikes kind of begin, it's usually about, April and March. And if you look at where we were in 2020, where we were in 2021, and that's the beginning of our launch, we are starting our March here almost at our system high back in August of 2021. So we're starting at 5416 before we head into our spike for the summer. So I just want to point that out, and I'm not sure really what to say other than I think we need to be prepared as a community. There's going to be a lot of folks out there this summer, and we're going to just need to be prepared to see some of these numbers increase over the summer. So I will open up to questions, and I've been talking here for a minute. Anybody have any questions? Jennifer, I think I see Jennifer.
Well, let me switch my
Jennifer,
view.
I had a question. And we've probably covered this before, but Stephanie, can you speak to when we were looking at the inflow outflow, those 2017 numbers that were super high, and then
Yeah,
I
that
know we're-
November.
Oh, Deb, back
2017
here.
number.
yeah,
Yes.
I'm just curious.
Yeah, that is interesting. I'm not sure what is going on there. I'll have to dig in and come back with an answer for that. I'm not sure what that is.
Oh, okay. No worries. Yeah,
Yeah.
I know we're focused on, trends, and so I was just looking back and thought, oh, that's interesting. Okay.
If I could, that just represents the starting point
Yes.
of the chart. So every person was in flow the very first month of the report. I think we had
sense.
talked about trying to hide that. And in one iteration, I know that we did, but yeah, that one data point in 2017, that just represents the start of the dashboard.
Michelle
makes sense.
Stokes had asked, is disability included, or is there a way to break that out of there so that you can see it?
On the system flow dashboard, no, what we have here for our subpopulations, these are the subpopulations that are decided upon by the COC. So that is just what we have broken out here. Our chronic, these folks are all with a disability. I mean, this isn't all of the folks in the system who have a disability, but everybody in the chronic category has a disability, if that makes sense.
Okay. She says, thank you.
Mm-hmm.
Other thoughts, Jocelyn?
I just have a really quick question. With the increases in summer, do you guys collect data to see if maybe these folks are just kind of off the grid and are coming in to seek shelter for heat relief? Is there, do you guys kind of capture data if they've been in Arizona for a while and they're just trying to shelter in our summer months?
Yeah, that's a great question. We do track that a bit here when we're looking at returns from inactive and then new clients. So what we're looking at is we're looking at folks who maybe disappear from the system for a time period and then have returned. So that's what that return from inactive. So that might be folks who, during the cooler months kind of stayed away from shelter and maybe had different arrangements. And then as the extreme weather picks up, they come in for shelter. They would kind of be captured in that category. I hope that answers the question.
Yes, thank you.
Yeah.
Vanessa?
And along those same lines, I know in coordinated entry, from what I remember, they collect reason for homelessness. Is that something that would be able to be compared to the spikes to kind of understand all of the factors that go into that spike there?
That could definitely be a deep dive that we look at if we want to look at what are the reasons that these folks are either coming new to the system or returning to the system. If they have a new reason entered, we can definitely do a deep dive looking at that.
The reason I ask is because I know at ABC we're looking at renewals and the rent increases and how that's impacting our members. And so I just would be curious to see that system-wide, how rent increases are impacting homelessness.
Yeah, absolutely. That's a great question. And I think a great point to dive into a little deeper.
Other questions? Is there anything that is, from what you all see, that is making you feel like there needs to be something that's done differently, or that you're looking to do differently or try differently within your organization as a result of what we're seeing when it comes to the spike in inflow? Or is everybody just going about business as usual?
I would just be concerned if folks are increasing the amount of shelter beds, or is there a flow that's consistent with the new folks coming in, where they'll be able to shelter some more of these folks that are coming in the summertime?
Thank you, Jocelyn. Other thoughts? That makes sense. It does. It definitely does. Other thoughts that people are having, or how are people looking to adjust what they're doing to meet the needs. I mean, if what we're seeing is correct, then everybody should be experiencing a higher number of people at their doors. And so, like, everybody's wondering, what do we do? We'll go to Michelle and then we'll go to Sylvia.
Yes, I was wondering if it's possible to label the chronic category so that it also mentions disability, because most people are not going to understand that.
Oh, yeah, absolutely. We do have a definition down here at the bottom. I should have pointed this out earlier. My apologies. We added some of those definitions to what the subpopulation is. So we have a definition down here with a disabling condition, and then the HUD length of time requirements as well. It gets a little clunky trying to put it up here. We did play with that a little bit, and we ended up having to stick it down there.
Yeah, if it could be included pretty clearly in that definition, that would be awesome, because I get a lot of questions on that. Thank you.
Yeah, absolutely. Thank you.
Thank you, Michelle. Sylvia.
So in terms of just doing things differently with the Department of Education, Homeless Education Project, I don't see us doing a big impact in these numbers, but we do have new funding for LEAs, and we have many. I don't know how many in Maricopa County who can utilize our art funds for a very short-term sheltering in a motel hotel for our families, but it's a really slow move out, and I honestly don't think I'll see any big changes this summer, probably not until the fall, but it's something that's there. So if any agency that has families with children, if they need a short-term couple of days stay, that's what, if they can get referred back to their homeless education liaison where the kiddos reside, we can continue that conversation and continue keeping track of that need.
Sylvia, thank you for that. Now, I have a question about this, though, or something to think about. I'm increasingly seeing in places where it's teachers that are the ones that are experiencing homelessness. And so does ADE have any supports in place for their teachers that are experiencing homelessness?
Not at this time.
Okay.
They are in the conversation with the build out of the housing on campuses with the school districts. It's there, that department is working with this another part of ADE. But my funding, my program is federal funding for the children and youth and their families.
Okay, so that is something for us to all think about, because I know like where there's supports for the families at the schools, but like I'm just, like people are coming to me more and more frequently with it's teachers, and then it's teachers on the family side on top of that, and so it's not where there's not like a direct link that I can do, but I try to like send them to the family housing hub, but I know like that doesn't help them today,
right?
So
I also have there's a sense that teachers with their own children, they usually are teachers with their kids to have that same schedule. And because of the program, and unfortunately, the federal definition or the federal title is homeless education, having to come to their peer or their coworker and let them know, hey, I'm experiencing homelessness, or I may be experiencing homelessness, can be very, jarring. So just training and keeping it open that this is no judgment. This is support for not only for the kids, but it's for the family as well. So if they can be open and they need if any of them need someone to communicate with them with, with the softness and that piece, please send them to me.
Thank you. Marcy.
Hi, everyone. I just wanted to speak to, things that we have going on to do a little differently, and Home Inc. and Threshold are about to do a massive press release of our landlord incentives, because as we know, we need units in order to house our folks. So we have a few press conferences coming up and a massive launch for these landlord incentives. So anything that you can do to tune into those press conferences and spread the word to any of your landlord friends, that we have the materials ready, anything that you can do to get the word out so that we can get a lot of attention on this. I think it is going to make a difference in getting us those units. So I'm excited about the press releases. So I just want to let you know that's all coming. It's pending in the next few weeks. So stay tuned.
Awesome. Thank you, Marcy. Nicole.
Just in response to what UMOM is doing, we are bringing online more family units.
Awesome.
Especially those geared towards larger families. However, due to supply chain issues, construction issues, it's been pushed back to September, maybe November. So unfortunately, the plan was to try to bring them online sooner. However, it's not going to hit until probably fall. So
thank you, Nicole. Help is on the way.
Yeah.
I can take one more. So Anne Marie.
Hi, I just wanted to say in response to what Community Bridges is doing, we have definitely opened up more of our hotel shelter beds. So we're increasing capacity to assist more people that are experiencing homelessness. And then we've definitely increased our rapid rehousing. So we have a lot more vouchers and we're out there advocating for a lot more of the EHV vouchers as well. So.
Awesome. Thank you. Michelle, is that your hand up from before or do you have another comment? Okay, she put her hand up. Okay, so awesome. Thank you all for that conversation. We're now going to move forward to the system performance measures by program type. In April, Solari Crisis and Human Services presented the system performance measures from October 2020 through September 2021. And as a result, the committee asked for further discussion to break the system performance measures down by program type. Nikki with MAG will provide a breakdown of the system performance measures by program type as it was requested at our last meeting. Go ahead, Nikki.
Thank you, Richard. Okay, so can we go to the next slide, please? So the purposes of this is during our last committee meeting, you all had asked for a presentation on the breakdown of system performance measures by program type. Unfortunately, these reports are programmed in WellSky, but we are able to break them down, be able to break down two that were of interest. Next slide, please. Excuse me. So the reduced length of time homeless. The first is the length of time homeless. The first bar shows the submitted system performance measure on the federal timeline from October 1st, 2020 to September 30th, 2021. It is the average amount of days from entrance into shelter to exit out of the system. This slide shows the breakdown of emergency shelter, safe havens, and transitional housing. As you can see, transitional housing is much higher than safe haven or emergency shelter. Next slide, please. So reduced returns within 1 year. The other system performance measure breakdown that folks express interest in is the returns to homelessness. The first bar shows the system performance measures submitted for 2021 on the federal timeline of October 1st, 2020 to September 30th, 2021. The measure includes all clients who exited to housing and returned to homelessness within 365 days. As you can see on the slide, this shows the breakdown by each intervention. Next slide, please. The hope is to start to discuss how we can make improvements. Solari Crisis and Human Services does have a provider report breakdown available on their Tableau to better understand some of the metrics associated with rapid rehousing and permanent supportive housing programs. And I'm happy to answer any questions, or I hope I can answer any questions. Glad we have Solari here.
Yes. What questions do people have? Nicole, are you already queued up with your question or that's your hand from before? Okay, so I'll go to Wendy.
Just a question. I feel like someone defined this for me. What is considered safe haven here in Phoenix? Is that domestic violence shelters?
So back in the day, in my day, a safe haven was a specific shelter that was geared to serve people with serious mental illness. And I'm not sure how it's defined now. And I don't know if Solari can answer that question.
Yeah, because I thought there were no safe havens anymore in Maricopa County.
I think there's still one in Arizona, but I know that we used to have the Novo Safe Haven at the Human Services campus, but that has changed or closed. And I'm not sure if Tyler Ty could let us know what that means.
Yeah, in the HMIS data standard, the HUD and VA classify a couple of the grant per diem programs as safe haven programs because of their focus on persons with behavioral health issues. So it is relatively small, and it is kind of a obscure program typing thing that happens in the background.
Thank you, Ty.
Awesome. Thank you, Ty. Allison.
Sorry about that delay. Would you mind going back a slide? I just want to make sure that I understood that this sort of the reduced returns within 1 year, is that like a 18% reduction? Is that what that means? Like, are these percentages like the reductions from 1 year, like within a year?
Yes, so I think each, and Ty, correct me if I'm wrong, how I'm reading this, reduced returns within 1 year. So that they have the overall 2021 system performance measure of reduction of, or is it increase or reduction? I think it's reduction of 18%. Then we have street outreach, and then it breaks down each of the interventions. Is that correct, Ty?
Yeah, so the way that this is describing is this is the actual numbers that were submitted. So the goal is to reduce returns year over year, and 18% of people that were housed in the reporting time period returned to homelessness. So this is not a comparative analysis. This is simply in our submission for 2021, what was the return rate for each of these types? This doesn't show year over year. So this is only 2021 system performance measure. It's not showing here's what it was in 2020 or 2019.
Okay, so like that's, I guess I was just confused between like what the numbers were showing and like what the label of the slide is. Because it looks like it's like the reductions of returns. And so it looks like, for example, like street outreach had 22% reduction in returns. I was like, wow, that's a lot in 1 year.
I can see how the title of the slide could be misleading.
So no, that's helpful. And so in order to really know what the reduction is, you'd have to know what the 2020 number was and then the 2021. Is that right, Ty? Or
yep.
Over?
Yeah, that's right.
Okay.
Thank you. Any other questions? Laura?
Yeah, I had a quick question on the reduced length of time. I'm assuming that the 102 and the 75 and 32 are days of homelessness.
So that,
is that the previous slide?
Yeah, it's slide 3. Yes, that one.
Yes, my assumption is days as well. Again, I hate to keep putting you on the spot, Ty. I'm assuming that's days, correct?
yeah, I can jump in and answer this one. So what this is the length of time that a client spent in these locations. So for 2021, for the patient. So that's the length of time that they're spending homelessness in the system overall is 102. And then for emergency shelter, safe haven, and transitional, that's the average length of time that they're spending in that space. So 75 days for emergency shelter, 32 days in safe haven, and 140 for transitional.
Thank you.
Yeah.
And then to add on to that, I would just say this doesn't count any gaps in service. So if a person spends 3 nights in shelter in January and then is on the street for the rest of January and then spends all of the month of February, it'll only count the actual nights that they receive service. It doesn't count any gaps between different service providers. But this will aggregate. So if a person goes between multiple shelters, it will add up all of the shelter stays and then find the average. So it's not the average time a person spends in shelter, it's like cumulative system utilization of how much a person is in shelter in a given year.
Thanks, Ty. I appreciate that.
You, Wendy? No? Okay.
Sorry, I forgot to lower my hand.
All good, all good. I have a question about this more like I'm just pondering. But like I'm curious how like so is the assumption made that when folks are leaving, you know, after that 75 days, that they are now housed, right? Or they're just those that was the amount of time they spent in emergency shelter. And then my second question around that is that the second layer of that is like, how does the blank, like when we don't know where folks are going, like if it is a matter of like after the 75 days, they're housed and that's why we are, or like when the answer is blank or they dropped off the face of the earth, like how does that impact the number? And so like, are the numbers actually higher than what we see here?
Richard, I can't answer that question, but
I know. I'm just saying. I'd love us to ponder it
Okay.
and to think about that. I don't really. We're over time, so I don't have time to actually like have Stephanie and Ty like to really dig into it. But it is a thing that like I'm always questioning, not so much the quality of the data, because I believe that you guys do an amazing job of the data. But I'm always asking, what are the questions in the data that we're not that don't obviously jump out to us. We'll move on. So next, the COC board has been completing the strategic planning over the past few months. Included in your packet is the board strategic visual, as well as an Excel document of steps to accomplish their goals. Kelly Williams with MAG is going to give us an overview of these documents, and committee will have a discussion on feedback to give the board.
Thank you so much for having me this morning. And as Richard mentioned, the board has been working on strategic planning for the last several months. There will be a visual on the first page that was sent to you in your board packet. Jeremy, can we go ahead and put up that slide? Thank you. This shows that data is at the center of your strategic planning and that you would like every activity to fall in one of these 9 categories surrounding data. 6 of the 9 categories are system performance measures, as well as a communications plan, monitoring and assessment, and regulatory roles and oversight as prescribed by HUD. As we walk through the following 3 pages, the board is looking for feedback on the following things. 1, are there things on this list that there shouldn't be? 2, are there items missing that should be added? And 3, are there things the committee would like to take on as the primary group responsible? So I'll give you a moment to look over this. Again, you should have it in your board packet if you want to have a paper copy in your hand. And then we'll move on to the next slide, please, or the next page. Can you make that larger, Jeremy, if possible? Okay, so to begin this conversation, and Richard, please feel free to jump in here at any point. Katie told me that I could really lean on you in this conversation.
Oh, good.
Let's talk about regulatory roles, oversight, and approval. So again, is there anything missing? Is there anything that should be added? Are there any areas here that you feel like the COC committee should be the primary party responsible?
And please let us know, like, because this is the time for us to be able to have the input. Hold on, can you still scroll back up? Okay. So this way we can go section by section. But like, let us know, because otherwise, you know, like 3 months from now, people start complaining about like things that MAG is doing in the strategic direction. And this was our opportunity to have voice in the process.
Richard, I have a couple of thoughts here.
Yes.
The monitoring and evaluating of COC-funded agencies for compliance into HUD regulations has been placed on the MAG staff, but I think there's a role for the COC committee to be involved there because we have expectations with our funding, and we want to know that we're all playing the same way. I think the same thing with the review and evaluation of the COC and ESG funded projects should have representation on it. from the COC. It's a subcommittee, and I think that someone from the COC committee needs to be on there.
We will certainly capture that feedback. Thank you. We appreciate that.
Thank you. Ty.
I have a couple of ideas. I'm looking primarily at the secondary group responsible column. And I think that a lot of the items that are listed typically do get brought to this committee for review. So I'm looking at like the governance charter, the HUD and OFO, the gaps analysis that are listed by primary group responsible as board and secondary group as MAG staff. I believe those are all items that this committee has historically reviewed. And I'm also looking at all of the HMIS things. So prioritization standards, HMIS privacy plan, data sharing plan, data quality plan, data sharing agreements. These are all things that we typically really like to get provider feedback on. And it's been this committee where we've solicited that provider feedback. So I'm wondering if for both of like many of those items that I just listed, it might be appropriate to list this committee as the secondary group responsible rather than MAG staff and the board, because ultimately all of these are going to get approved by the board anyway. So that would be my feedback.
Thank you. Any other feedback on this section? I think those are all great points.
I do have one more. I don't see it in the other areas, but we have in the governance charter, specifically an area around standards of excellence or standards of care. And I'm wondering if maybe that needs to get split of the governance charter that outlines kind of the primary roles and responsibilities of all the groups, that should remain the board primary function. But there's that entire sections of standards of service, standards of excellence. I forget our exact wording, but that really was primarily coming from this committee and this work group. So I'm not sure how to address that, but that feels missing from this document here.
Thank you, Ty. We'll make sure to capture that feedback.
Awesome. Okay, now let's scroll to the next section. So monitoring, evaluation, and technical assistance. Same thing. What do we see? What do we feel? What's shouting out at us? What's going to cause heartburn?
I would like to add one piece of feedback to this, Richard, for the committee to keep in mind, please. I should be more formal, chair, by our co-chair and members of the committee. We have thankfully added several new staff members to our homeless team at MAG, including a full-time monitoring position. And so Cleo Warner has joined our team, and she will be serving as the lead for monitoring for our staff. So we do have a full-time person who will now be assigned monitoring and evaluation, just as something to keep in mind as you have this conversation today.
Thank you. Does anybody see anything in this section that they want to raise? As you see, most things within this section are held between MAG staff and the board. Okay, let's move down one more.
Andy, that the committee has had some feedback.
Laura, I'm sorry, you're breaking up.
We lost your audio. You got muted. Like actual mute.
Laura, if you're unable to provide your comments
we
here,
lost her.
Okay. Ty, your hand is still up? Okay, now it's down.
And does anybody have anything else in this communication section?
I just have a quick question. Do the COCs, I know there's 3 in the state of Arizona, is there any conversation or communication that happens between the 3 of you to strategically plan or update each other on what's happening across the state, or is it just separate COCs running separately?
So Jocelyn, I can answer that to the best of my knowledge. What I will tell you is I know we do communicate regularly with the COC and Pima County and Balance of State on specific projects. I don't know that we're necessarily communicating on COC strategy across the state. Nikki or anybody else from the team that's on the call that may have more information, please feel free to jump in.
Yes, Chair and members of the board, or sorry, committee. We do meet regularly with Balance of State and Tucson Pima County. We are strategizing around our scorecard, what our scores were, how we could do better. And we also have started to meet on a, I want to say monthly or quarterly basis. I need to double check on that timeline, but we are working together strategically, but not specifically to some of the questions that you had raised, Jocelyn, but we do work very closely together.
Thank you.
I would just like to remind members of the committee, please respectfully to not use the chat function because it is not visible to everyone who is on the Zoom. If you do have comments and your audio is not working properly, we're more than happy to take those by email and we can incorporate them into the minutes as well. Thank you.
Thank you, Laura. To raise what was said, hold on. Ty, let me close Laura's comment first. So she was sorry she was lost. What she said is that I agree with Wendy that the COC committee in the past has had input on reviewing the NOFO scorecard, and I think the committee should still have some input in that process. And she apologizes for the technical issues. Go ahead, Ty.
In this section, there were just a couple of terms I wasn't familiar with. What is the communication work group?
Sure, I can speak to that, Ty. There is a new work group that has been formed to help develop a communication strategy among COC-funded providers and to make sure that we are all speaking to the same talking points, et cetera, especially as homelessness and individuals who are unsheltered across the region are drawing more press attention. We want to make sure that we're all speaking to the same language and being able to communicate how we're effectively using HUD dollars to try to address the concerns of the unsheltered population. And so this was a fairly new work group that was created. And as you can see here, there's responsibilities by both the board and MAG staff to try to coordinate those talking points. Additionally, we have been asked by our regional council, which is a separate governing structure here at MAG, to communicate what the COC is working on and how these HUD dollars influence their municipal programming or even their residents in their cities. And so we're trying to just, again, improve communication both directions.
That's great, Kelly. Thanks for sharing that. Under which committee or board is that work group? Is that a board work group?
I believe it is a board work group, Ty.
Yes.
Great, thank you.
Any other questions, concerns, comments, things they want to raise? Elements of heartburn. You might need some Prevacid, right? For this section. Okay. So now we have the system performance measure, reduce first-time homeless, system total of clients entering a homeless project without a prior homeless entry in the past 24 months, includes emergency shelter, transitional housing, and safe haven. Thoughts on this section here?
I'll just say that I love integrating homeless prevention dollars into coordinated entry because I think prevention is one of the #1 goals in being homeless or falling into the system. So I absolutely love that that's at the top of this list.
Collaborating with other systems of care to promote access and integration with the coordinated entry system. Like from a secondary function, would that more so fall on us than the board? Just as a thought. Just as like, that's essentially like what we are. people across the systems. So like something within, like a thought within that, Kelly. Other questions that come up for people in this particular section?
I'm just curious, is if I'm reading it right, that race equity is not a part of the coordinated entry strategic plan?
Nikki, can you speak to that?
Excuse me, race equity is an important piece that the coordinated entry subcommittee is focused on. And they are working with Home Base as well, who has been hired as our consultant to review our coordinated entry system. And equity is a top priority.
So
It's not a part of the strategic plan, right? Or you guys are just addressing it in a separate issue outside of what we're seeing?
Yes, and your recommendations, we could take those back to the board to have them incorporated, Jocelyn.
Yeah, I would really like to see it here. I mean, and I don't believe the board is working on that separately, but I just think race equity is so important, especially in Maricopa County. I was looking at the actually the MAG report that you guys did with race equity partners, and just reviewing that report, it's major, you know. So I would definitely really like to see that a part of coordinated entry.
Thank you.
I really appreciate you saying that, Jocelyn. I think, MAG staff have to be very careful about tempering our own opinions in these conversations, but I will say I think we cannot add race equity enough to this work from what was found in that report. And we have a lot of improvements to make in race equity and how individuals of color are being treated throughout the coordinated entry system.
Thank you, Kelly.
Yes. So my thoughts on this are, I understand that race equity is named as a priority. It is important to make sure that the words racial equity framework are not just like put in places to make them like a thing, because otherwise it's not. I will also say though that if we are not, like if it is not, like if it's a priority and we don't see it in this document, then it risks just being like a tagline that we were invested in for a couple of years because that's what the country was like, you have to be doing something about it, which like equivocates us to the oppressors in that particular way, because like we were just teasing people. So I think it's really important that if it's going to be a priority, it needs to show up throughout all of these different things and like how it touches it, because it's not something that is meant to be marginalized when it comes to how it's placed. It has to be like integrated. If it's not integrated, it'll never be successful. And then we're just talking about it. So that's my feedback to give. Yeah, that'd be my feedback.
Noted, Chair.
Thank you. Any other questions, thoughts, concerns, heartburn that people have when it comes to what's there? Okay, let's scroll down so we can just see it. Okay. So the one piece that I would say here when it comes to the strategic plan, there has to be some room for radical movement. And what I mean by that is, like, when we're talking about, like, yes, it's good to review long-term stays over 98 days, and we want to add 770 units of temporary housing, but we know there's a lot more people than that, right? And I'm not saying it's all on MAG or the coordinated entry system to figure this out, but like we've got to be able to like reach and stretch in the ways that are uncomfortable with our goals, and if we're not reaching and stretching in ways that are uncomfortable, like this section here, just to me, should be the one that when the board chair goes through it, like people start to, I don't know how we're gonna do that, right? But like figuring out, like, you know, also getting inspired at the same time, like, oh, but let's figure out how we do that. Because those 770 units, I'm pretty sure that even when I think about like what we have sight on right now, like we could probably, like, we see that already, like between like things the county are doing and cities doing and other agencies are doing, like we can already see that, but we know already that those numbers aren't good enough. So I think we have to stretch it, and whatever they deem that number is where it should be. But like it's got to be something that like we see it as a system, and we're either uncomfortable with the fact that they want to stretch that much, or we're like, yeah, let's go get to work. That's my thought. Anybody else have any other thoughts in this section? Okay, let's move, because we almost out of time for this. Okay, so we'll look at these three sections as a whole. So some performance measures.
Oh, Richard, Jim has had his hand up for a bit. Excuse me.
Oh, I'm sorry. I didn't. Jim, go ahead.
I'm sorry. Can you hear me?
Yes, we can hear you now.
I apologize. The mute function was not working, and so I've been trying. But why don't I save my comments till the end, because it was about a past section. I'm sorry.
You're good, Jim. Go ahead.
And Chad,
already over time.
Having problems. So should I go? Sorry.
Yes, please.
Okay. Chair and members of the committee, back on the communications section. There has been a subcommittee, or I don't know what the title is, but Katie has organized another committee within our group to look at communications and PR and those sorts of issues to, I hope, feed into the other committee that was mentioned on that other graph. So that's going on, and I want to let folks know that that's going on, because we have talked about that in our group here in past meetings. Does that make sense?
It does. Thank you, Jim.
Okay, thank you.
Okay. Any other thoughts in this space?
Sorry, guys, I do. So the review rapid rehousing and PCH returns to homelessness by program. So I know the board is a whole super intelligent board, but I was just curious if there was conversations around the reasons for returns to homelessness, and if a deeper dive is being taken to kind of see what some of the struggles the folks are dealing with. And a part of that could be they are not referred to the, for instance, the rapid rehousing folks need permanent supportive housing and aren't able to, sustain themselves after the program is ended. I was just curious if the board has taken any of that into consideration to enter that into the strategic plan.
Co-chairs and members of the committee, I am not familiar if that has been done, Jocelyn, to answer your question, but we will definitely take your comment back and try to address it with other staff. We will be sure to communicate with you.
Very good. Any other thoughts, concerns, issues? Okay, is this the last page, Kelly? Or is there another page?
We have a little bit more.
Okay. Okay, so here again, thoughts, concerns, heartburn.
And co-chair and members of the committee, you will notice there is not a secondary listed for the last system performance measures. That might be a point of discussion for the group.
Are these areas where you all would like input? Developing a move-on strategy to PHA vouchers. Discuss with the PHAs the ability to increase project-based voucher allocations to support lit developers, low-income housing
Tax
credit, sorry. Developers by subsidizing their units by 30%, or discuss with coordinated entry the ability to connect referrals with low-income housing tax credit 30% units. Okay, hearing none. Okay. Data. So where do you all feel we should have input in the data space? Because right now we're not held accountable in any of these areas. I would say that on that third one, the deep dive into data to ensure folks in housing are not being pulled back into the by name list. We are in the space of reviewing the system performance measures. We do that every month and providing feedback for improvement. We are the primary there. Review the system flow dashboard. We do that as a part of our meetings. Ty, oh, I see your hand.
You know, so something I'm wondering is, I'm not sure if it goes in the evaluation and monitoring section or if it goes here, but something that I would view as important for this committee is to be providing feedback on the measures that should be used for monitoring and evaluating programs. And so I don't know where that fits, but I would like to see that called out somewhere.
Thank you, Ty. I'm sure Kelly will capture that. Anything else that people are seeing? Okay. Kelly, is there more? No?
No, Chair.
Okay. So in that space, if there are no, like, if anybody, like, as they're reviewing the packet, please read the packet. It's important. As you're reviewing the packet, again, after the meeting, or you're thinking about the meeting, or you're driving home and it's like, Eureka, right? Like, this is a thing I meant to say and I just couldn't say it. Please email those in to Katie so that we can make sure that those get in and we can have that feedback included. Maybe you wanted to start a fire in the midst of this conversation and you just forgot your matches. So if you want to, you know, like, relay that information in regards to there's something that's not being presented in this space, like, please, by all means, do so. We're going to move on to the next agenda item. Thank you so much, Kelly. Thank you for the work that you were able to do to be ready to present on this. Thank you. Okay, so we would like to bring together a work group to review the community adopted best practices. This group would meet throughout June and bring back recommendations to the committee in July. These best practices drive the work to the community and include every intervention type. Okay? Do I have any volunteers interested to say, like, oh, that's my stuff? Who wants to do best practices? Vanessa? Awesome. Who wants to join Vanessa in the best practice work? Nicole? Okay, I'm excited. I see it.
I'd love to join, but I'm out for a week in June. Would that be okay? Or do you guys want to check in on
that? Y'all can work it out. So let's include you in the mix. Okay. So awesome. So we've got a fearsome foursome. And if anybody else wants to add their names into that, by all means, communicate that with Katie, and then we can get down with that. Now, this next part. Okay, so, like, So Laura says she's been having technical difficulties with the computer. She would also like to participate, but she's also out during part of that time. So if you guys can work that out and see like what that could look like, that would be beautiful. We look forward to your report in July. Now, this part I'm super excited about, right? So we always talk about, we like talk about data and then we don't do nothing with the data, right? I love data. Like I love swimming through the data and all of, well, I love like diving into the data, but we need to dive and then swim so that we're doing something with it. And we're having like an opportunity to really like wrestle with it, okay? So we're gonna host a data walk to better understand the data available in the community and how we can impact change, okay? The data walk will be hosted on June 16th from 9 to 11, right? It's gonna be fun. I'm gonna facilitate it. I'm jiggy about it, right? I went all the way back to like Will Smith with it. I almost did like the jiggy dance about it. But anyways, at the MAG offices on the second floor, Katie would like to apologize for the incorrect date because I think she originally sent out like the 14th, but it's going to be the 16th. Yeah, it's on the 16th. The data walk will be a hybrid with the encouragement to attend in person because there's pieces like you're going to want to be able to interact, but we also don't want to leave anybody out. And then just a couple of pieces within that we're going to ask for, right? So I'm asking for you on that day to bring your data. I know it's scary to let other people see your data, right? But have people bring their outcomes data so that we can look at it. Like we're going to interact with it. You're going to be asking questions about the data and putting sticky notes up and answering questions. And it's going to be an exciting experience. But like, we need to be able to see each other's data and it's okay. Like everybody's doing what they're doing and you're working hard. And if somebody's got like amazing things they want to show, or that some people have some challenges, it's all love and it's all good. But we all make change by being able to see what this thing actually looks like and what we're wrestling with. And so like one of the walls in the 4 rooms is going to be just all of our data, right? And then it's going to tell us some things. It might tell us that none of us are looking at data in our own programs enough, right? Or it might tell us like, wow, we've got a lot of data. You know, like maybe we're drowning in data, but like we need a lifeboat for execution, right? So that we can get on the boat and then do something with it. But like we're going to break down and do a lot of like not just wrestling through our own programmatic data, but system flow data. We're going to definitely ask that question. Michelle's not here because she had to go, but you know, around disability. It's gonna be a data day, right? Like Matthew Brest, like I want to get him a shirt that says I love spreadsheets, right? This is gonna be one of those kind of days, right? But I promise it won't be like data dull. Right, we're gonna make it data exciting, data dynamic. There we go. See, we doing like these things. Okay, so in that though, the question that I really have is, one, are there particular data points people know they want to see? Like we talking about this deep dive around. Jocelyn was talking about a deep dive around like reasons people end up back in people return to homelessness, right? That's one of those points that we figure like we need to do a deep dive and have people be able to see that and have that disaggregated. What are other points that you're like, I just really wish I had this data point and like to understand it and like we can get in it. Like what are those points? Sorry, y'all getting all my enthusiasm right now. So you think about it, right? Think about what those things are. You can email those questions into Katie, right? This is the time, because otherwise, like so many times we're so confined in time, we don't get the opportunity to really dive into this. But like the goal for this activity is one, all of our folks are we're gonna be there, we're gonna open it up to the board, we're also gonna open it up to the public, okay? So that like folks can come and really engage with the data. Right? We want to have like a good facilitated conversation about what we see with the data, but above all, what we want to be able to do is take some things that we see here and then make some recommendations that come back to the committee for us to vote on in terms of like, oh, like we can develop, like we can integrate these strategies, right? But we want to have a data day. So I would ask, please, bring your data. If you don't, it's not your ticket to admittance, to admission. So you're not going to be turned away. Okay, thank you, Laura. So you won't be turned away. Secondly, right, bring your inquisitive mind, right? This might be the thing, like if you were bringing a +1, like if you've got a data person in your organization who like dreams about numbers and stuff, like they dream in the matrix. This is a thing like to bring them to, right? Because they may be thinking of things in this, they're like, oh, I thought about this, and where's that correlates to, and the slope of this, and the hypotenuse of X, It's not going to be that mathy, but I'm just saying. But yeah, like we definitely want folks to be able to come and to engage and to use this as a model for how we can meet outside of this particular meeting to do work. Because I believe that the folks on this call want to mobilize in different ways. And so this is my like small test of change to see how that works in person around like how we can use the collective influence that we have as a committee and through all our various organizations to touch to be able to drive the work forward in just a different way than what we do, so that we don't just meet to meet, because we should meet to do, right? Does anybody have any questions, thoughts, heartburn, anything about this data walk activity? Go ahead, Sylvia.
Okay, I feel like the odd man out. My data is, school-based.
It's all good.
Nature. With that, what kind, can you just give me some parameters of what I should be looking at, like the school years, this year, last school year?
What do you, so like I would have the last year's data, but it's whatever you want to show.
Okay.
So you may want to bring up 2 years data. You may want to show, monthly data, weekly data. I mean, it's about what you want to show, but it's over time and disaggregated.
Okay. Yep.
Yeah. Allison.
My question was just that do we need to sign up for this data walk, or do we just show up?
I think it's best to sign up. People can just show up because some people will just show up. But I believe that Katie's sending out an email with like an RSVP.
Okay. Yes, we would prefer to have chair and members of the committee. We would prefer to have RSVPs if possible, because we are still distancing. And we would like to have a count of individuals who will be in the building versus those who will be participating virtually. And we will be trying to offer both. We will be offering both options. Of course, if you're not here for the full walk, it will be a little more complicated to be able to participate virtually, but we're going to do our best to meet the needs of both groups.
Yes.
So there will be some kind of invitation forthcoming is what I'm hearing.
Yes.
Yes. Vanessa, I saw you had your hand up.
It was just answered. Thank you.
Okay, awesome. Awesome. So yes, like what you bring in terms of your data, it's like really your outcomes data, but it's like what makes sense to you, but also like please disaggregate it, because that's where we get into the real questions around what we're seeing. If we leave it, aggregated, it shows the outcomes, but it doesn't tell us what's happening within that to create that. If no other questions, I turn it back to Wendy.
Hi, everyone. This has been a fun one. I can't wait for this. So we're going to lean in here now and have a request for future agenda items. Just so you know, this data dive is part of that, of us wanting to know what goes into that data so we can address that. Other topics, anyone just unmute your mic, identify yourself and speak. I'm not seeing anyone. You're always welcome to email co-chair Cruz, myself, or Katie at, Gentry at MAG with any of your topics. Thank you. So then we also have an opportunity for comments from the committee. We're running a little bit late, but your announcements matter to us. Are there any events or announcements that members would like to highlight? Again, unmute, identify yourself and speak. Okay, it appears that we have no further business and we can adjourn the meeting right on time. So thank you everyone for your participation and looking forward to seeing you in June.
Thank you, everyone.
Thank you.
Y'all have a wonderful day.